presentation. So we're now going to have a question and answer period. Our panelists there all have microphones, and if somebody has a question to be directed at Tim, then I'll communicate that to him, or he may hear it directly from the microphone.
I was sitting on one.
So we're open for comments and questions now from anybody. There's one microphone at each side of the room. Okay, well, while we're waiting, well, no, some people are headed that way, it looks like. And again, please identify yourself.
Sure, Sheila Fleischacker, NIH. I just spent the last 2 days with my dad, who's a retired fire chief, so I'm using a fire analogy. But over the last 10 years, as you know, I've been kind of following the food marketing to kids issue. One of the things that's always been somewhat problematic to me, and I'm not sure, you know, I know it's a piece to the puzzle, but I'm not convinced the way we've weighted it today or weighted it in 2006 that it should get as much proportion as it does. But the idea of, you know, social marketing or, you know, campaigns using, you know, more healthy foods or healthy messages to counteract food marketing to kids that are of less healthy food. I mean, that idea of kind of using fire to fight fire. I mean, it's still promoting sedentary behavior. It's still promoting, you know, being attached to your mobile device or TV, you know, viewing these things or being on web to see even, you know, positive content or health literacy education. So I was just wondering if you guys can kind of comment on, you know, are there other ways to invest funds that aren't connected to marketing, even if it's positive messages?
Okay, anybody can care to respond?
Sure. I mean, I think there's almost no way around it, though, because so much of where people are getting their information right now, especially like our members' moms, is online, you know, and so they could be sitting in front of a TV or in front of a computer terminal, but they also may be on their mobile devices. I mean, we know people work out and check their email at the same time. So I think we can promote many things still using those same tools. But definitely on-the-ground engagement is a big part of it. You just can't reach as many people at once in person as you can online. And so that's kind of like the limits of that. I mean, I think the number was $500 million a year for the Truth Campaign to utilize traditional media. Now we have social media, and I think everybody just wants to seize the time and try and use that tool, which is free, except for, you know, you have to staff up the people to put out the messages. So that would be my answer to that.
I would just add that I agree that you have to go head to head in that space, but the message does not have to be solely limited to an alternative food message, because obviously food and movement go hand in hand. So I think the messages can be about that as well. And I do think that there is a trend to safe access of mobile devices while in motion. I mean, I don't want to, but you now can, and that people are doing it, have a desk that's literally a treadmill that's moving at a certain speed, and you're able to do phone calls, you're able to work, and you're in constant motion. So I think that too will evolve. I also think that we know from the literature that about one ad is equal to 3 to 4 ads on the other side. A counter message, you can outweigh 4 ads on the other side, and that's a plus. You can do even better than that if it's attached to a social movement, and if people are in an act of pushing back, rebellion, forging a new path. And I think it sounds to me that your presence is one of those presences that is forging a new path and galvanizing a group of people in the interest of multiple issues. So I think that's another element here, that it's not just an ad versus an ad. It's a corporate interest versus a movement type interest.
I would just pipe in one additional comment, which is that, you know, if we're learning from tobacco control, what we know is that a social norm change movement, counter marketing is an essential component, but you need multiple levels of intervention in order to change the environment around people to make healthier choices easier. So that comes from everything from individual healthcare, you know, conversations of people with their doctors, to education in schools, to media campaigns, to institutional changes, employers, workplace wellness, to law and policy. You know, whether it be taxes or, you know, in the tobacco contest, taxes or secondhand smoke, or retailer licensing ordinances, and we're looking at analogies now in the food arena. So countermarketing is one part of a much larger environmental social norm change strategy if you really want to make change.
I think there is a evolving definition of social marketing. So if you look at Moms Rising in Abu Dhabi, Omaha, what we're really doing is creating a platform to connect people and to empower communities. It's not so much about selling a particular health message or deliver a health education message through the online portal, but it's really about creating containers for community action and mobilization and coming together. And then once you have that infrastructure, then the possibilities are endless. You can do a lot of other things, including implementing novel health education messages and et cetera. But I think that this particular part of social marketing is a little bit different than how we traditionally think about, like marketing in terms of either like the Truth Campaign is really about, conveying or tapping into the fear, the emotion, with regard to a particular product, or in some of the older public health social marketing campaigns that we've seen in the obesity world, it's really about selling a particular health message, right? So I think the marketing environment is so much more integrated, and because of the advent of social media, we need to kind of think about and expand the scope of what social marketing really means.
Okay, thank you. Jennifer?
So there's one issue that we struggle with at the Red Center, so I was hoping you all might have some great insights into this. In the session before, Kathy had mentioned that consumers tell them all the time, we don't want to know what we want to know what we can eat. We don't want to know what we can't eat. And in terms of addressing obesity, what all the research tells us is that it's not a matter of exercising more or eating more fruits and vegetables. It's a matter of eating less and eating less sodas and fast foods and the things that create obesity. So I guess my question for this group is, how do you create a social marketing campaign, counter marketing that, sort of is effective but doesn't turn people off, and not want to hear your message?
Well, and a related question that might be interesting for Cheryl to answer is that if you're going to do a counter marketing campaign, do the companies need to be stigmatized or just the products they sell?
Well, in answer to your question, I do a couple quick corrections. The Truth Campaign is about $100 million a year in its highest spending years, not $500 million a year. And second, while fear is a motivator in many anti-tobacco campaigns, in the Truth Campaign, it was really all about capitalizing on the natural rebelliousness of teens. It's a time when they do tend to want to define themselves and have them define themselves as against an industry in the business of killing them. And to be perfectly honest, to the extent that the food industry wants to persist in producing food that is contributing to the ill health of our nation, I think they deserve the same treatment. And I'd say the same thing for the alcohol industry, to the extent that their business model is dependent upon kids becoming daily drinkers before age 18. That derives 25% of their profits. That segment alone. The other 25% are people who are drinking excessively on a daily basis, so close to half of their profits generated by two markets that really ought not be markets. So I think it's a very complicated situation, and I do think that an element of it is getting people riled up, and I think they have a right to be riled up. I also think on a regulatory front, everyone says, oh, it's so hard to regulate, it's so hard to regulate. I don't buy that at all. As a matter of fact, the absence of regulation is what's causing the problem, because if you have a regulation and you set a level playing field, then somebody who's not getting the fat, salt, sugar combo that they're used to getting at X outlet isn't going to get it at Y outlet either. And I think if you don't move in that direction, then they have a legitimate business argument that they're being treated unfairly or strategically unfairly in some way. So I'm a big fan of regulation, especially in this space. I don't think we're going to get out of the obesity epidemic without it. I do agree that people don't like to be told what not to eat, but I also believe there's an enormous amount of evidence that based on socioeconomic status, people do not understand the lethality of what they eat. And I think the study that showed the impact of the food labeling on restaurant chains in New York having a no effect on residents in low-income communities is a case in point. As a matter of fact, there's some evidence that the more the calories delivered, the better the economic bargain. So, you know, there really is an educational road that has to be climbed that may be fueling, don't tell me what to eat.
So Cheryl, let me follow up on the.
Oh,
I'm sorry. Go ahead.
I was going to say that there is a difference between folks in the community feeling that the government and administrators are telling them what to eat, even policy advocates. But I think if you create a space where there's peer education, I think with the Truth you're talking about that, where it was like, this is led by teens to protect teens. I think when you can create an environment where you create a dialogue, which they're having in Omaha, which a lot of what the blogosphere is like, is where parents are exchanging information. We found that it really changes the nature of how that information is heard and perceived. In New York City, you know, Bloomberg is seen as this benevolent dictator. So no matter what he puts forth, you know, it's like, here he is again telling me, you know, even people who are for regulations and don't have the nanny state, you know, agenda that they're putting out there, perceived it a certain way, where if it had come from advocates, if it came from peers, a movement that seemed organic to the community, then it's received very different. So I think that you also have to look at the messenger in addition to the message.
I think, yeah, I mean, in our case, I didn't get a chance to show you the whole website because of time constraints, but if you go online and really look through all the different videos associated with the different projects or different sub-projects, you'll see that the overwhelming message is really about moderation as opposed to elimination, and it's about think twice before you act. And again, it's really about creating a space where people in the community can talk to each other. And you know, I think that, you know, to really get at the heart of your question is really going to take, like, you know, what my co-panelists have said, you know, multiple strategies across, you know, various levels to lead to that reduction of consumption that you're talking about. But the regulatory and the litigation approaches, I think, are very interesting, but that's going to be more of a long-term solution. So in the meantime, you know, what can we do? You know, I think what Moms Rising and what WWM are suggesting is one of many approaches that can be taken on right now. You know, Michael Park is going to talk about an industry approach with the Access to Nutrition Index that I think is going to actually create a whole different competitive domain within which companies will have to try to differentiate themselves from each other by reformulating, you know, their product lines. So that's also going to be very interesting once it's launched in the new year. So.
Okay, thank you. So in order to end on time, we still have 6-7 minutes. I'd like to make sure we get our questions asked and answered. So Pat, go ahead.
Good. Wonderful panel. Thank you all. I have a specific question for Tim. He mentioned that the definition of junk food was becoming more well accepted. And in this country, I don't know how we can get to that place. We're kind of struggling with it. We have healthy foods that are now becoming less healthy with things that have been added to them. We have unhealthy foods that are being modified to be more healthy. I mean, how do you, that sounded too good to be true, so maybe Tim could tell us a little bit about the process of coming to consensus on this very complicated issue here.
Yeah, sure. It wasn't easy, even within the UK, where we now have one system for defining what's permitted to be shown on TV programs for children. Even that took quite a struggle. It took an expert review, that was then challenged by an industry review, and that was then held to a sort of presidium of experts who then decided that the first expert review was correct. And then there were a series of models that were tried, about 35 different models, and in the end one was accepted. Now, I don't think even now our present government would probably have gone through that process. We were lucky. We were in a period when there was a move to try and solve the obesity crisis, and that's certainly significant, combined with quite a strong sort of pro-nutrition action within government and a weak industry at the time. We've got to reverse that now. We now have industry sitting in on government committees, and I think if they could reverse what we had done in the past, they would, but they haven't been able to. So it's not an easy task, I agree. I just wanted to register the fact that things have moved over the last, let's say, 10 years, from a period when you could not define junk food, and the industry would tell you there is no such thing, it's only, there's no such thing as individual bad food, it's only a bad diet, and so on. We now do have a series of definitions. And just to comment on the previous one about should we condemn brands or companies, and I think what we're finding in the UK is a voluntary system at the moment, but we have these traffic lights on some food products that indicate red, amber, or green according to various nutrient levels of fats and sugars and salt. And the companies that are using it have acknowledged that the use of these lights has changed purchasing behavior, and more significantly, it's changed the company's attitude to its formulation, so they are reformulating their products to reduce the fat, fats, and sugar and salt. Now, that's a real public health measure, because whereas the labeling bit was probably only useful for educated people who looked at labels, the reformulation applies to anyone who buys the product, and that's really valuable. So, again, a traffic light approach is quite interesting, because that's providing consumer education. It's not being something, it's not a regulation, it's just giving consumers more information. But it's information the industry did not want those consumers to have, and several of them have resisted it even now.
Thank you. Why don't we end up with a question from Shariki?
Right. Shariki Kamanyika, a standing committee. My question is primarily for Cheryl, but if other people have insights, I'd love to hear them. Cheryl, you mentioned the tobacco companies giving money to communities, and this is something that I've been aware of for the Black community, for Latino communities. The resources are needed in a lot of these communities, and I'm wondering if there has ever been any attempt, say, for a foundation or whatever, to offer to replace those funds in order to begin to get mobilization in communities that are just being bought off by these companies.
That certainly has gotten airtime at various places, including the Council on Foundations, and it had a lot of discussion within Legacy, and there are case-by-case situations where that is precisely what happened. But there are two things I think that are notable. One is, while the amount of money seems like a lot, it's vastly less than the amount of money that was spent on the media buy to tell America about it. And I mean vastly less, like less than 10%, just to give it a scale. The second is that it's reduced now. In other words, the strategy, there was terrible coverage in one of the major media shows, and the strategy has, I think, been backed off of a little, and a lot of those monies are instead finding their way to political coffers and other places. That said, I do think that the point you make is a very, very good one, that it would behoove the major foundations of the United States to get together and figure out a way to be some kind of a counterweight, not only to tobacco industry funding, but similar types of funding where there's an implicit, if not explicit, quid pro quo, which puts, minority organizations, women's organizations, in a very tough spot.
Yeah, thank you, because this is a big issue with soft drinks, food companies and beverage companies, just putting money out there that you can't really blame communities, since it's not tobacco, for taking the money, but it causes a problem. Yeah.
I wanted to say something really quickly on that note, because yesterday in my neighborhood and neighborhoods across Brooklyn, PepsiCo is delivering truckloads, tons of Mountain Dew to people who are displaced by Superstorm Sandy. Mostly people who are still displaced and who are still without power live in NYCHA public housing projects in Far Rockaway and in Coney Island. That's the demographic in Brooklyn. It may be different in New Jersey. And so it's a very interesting dynamic and conversation to have with community groups, not only about taking money, but the goods, you know, and how what they're giving compared to what they'll use that for in terms of telling the world about this. We fed Red Hook projects with truckloads of Mountain Dew. You know, it doesn't even, it's a drop in the bucket compared to that, but it's really hard to turn these dollars away. It's almost to that level, like it is with this hurricane donation.
That issue comes up in the context of contributions by the companies to food banks and other places like that, and contributions to the hunger community. All right, well, boy, this was a really interesting group of presentations, and the discussion from the audience was great. And thanks especially to Tim for joining us at such a late hour in the UK. So let's thank all our speakers, please.